Hello everybody. So today we are going to see another one more topic, which is mainly an essential hallmark symptom, or you can otherwise call it as a sign of acute appendicitis, which is easily elicited in all the patients, and henceforth you can plan in for either medical or surgical management after the confirmatory diagnosis by using the ultrasonogram of abdomen. So starting on with the sign. So the first sign which we are going to see in this appendicitis is that it is called as the Bachelor's sign. So this Bachelor's sign, you can see that there is a sharp pain is being created when you compress the appendix between the abdominal wall and the iliacs. So this is a condition where you can see of a case with a chronic appendicitis. A patient is having severe sharp pain upon compressing between the abdominal wall and the iliac region, where you can see here the examiner is palpating far well in the umbilical region, just below the umbilical region, the thumb onto the right as well as onto the left. So it is like the compression of the appendix between the abdominal wall and iliac, which produces severe sharp shooting pain, which we call it as the Blasser's sign. The next sign which you can see in this picture is that we call it as the Blumberg sign. So this sign is mainly transient in the abdominal wall, and we call this as a rebound tenderness, and it is mostly due to appendicitis as well as in case of any perforated peritonitis. So in this picture you can see the examiner is compressing to the appendix region, and henceforth you can see there is a deep compression, and upon compression the patient is not having pain, but slowly when he is slowly releasing the fingertips from the abdomen, patient is having a sharp shooting pain, which we call it as Blumberg sign, or it is otherwise called as rebound tenderness. The third important sign which we can see in a patient with appendicitis is that it is called as the Rovsing sign. So in this picture you can elicit that, like the green, which is showing that the palpation to be done over the left lower quadrant, especially near the iliac fossa, and the patient will be complaining of pain and tenderness on the right iliac fossa or might be on the right lower quadrant. So this is the hallmark sign of Rovsing sign, which we call it as the pain which is being radiating from one side to the other. Like upon compressing on the left side, the patient is going to have severe sharp shooting pain onto the right side. The next important and very commonly known sign is the McBurney's point. So you have to do like draw an imaginary line from the umbilicus to the anterior iliac spine, and then it is like you can see on the midway of the umbilicus and the anterior iliac spine on the lower third part is the presence of the appendix, which we call it as the McBurney's point. And when you palpate on this particular point, patient is going to have a severe sharp shooting pain or tenderness upon palpation of the right anterior iliac spine, or you call it as the anterior iliac fossa. The next important sign which we can see evidently in patient with appendicitis is that we call it as the Soya sign. So pain is being present in the right iliac fossa with hyper. So this is the right iliac fossa. So you can see the examiner is doing the hyperextension of the right hip, and the patient is having the facial grimacing due to the severe sharp shooting pain of the appendix, inflamed appendix. This is mostly seen in a case of a rectocecal appendicitis. The other important sign which we can see in a patient with appendicitis is that obturator sign. So here also the examiner is going to do some manipulative techniques and find out the type of tenderness. So pain is going to be present for the patient in the right iliac fossa when we do a manual technique, that is internal rotation of the flexed right hip. So here the examiner is holding the patient's angle, that is the knee and the hip in right 90-degree angle, and then the internal rotation is made. So upon doing this internal rotation, patient is having severe tenderness, which indicates that patient is having some sort of perforation along with pelvic appendicitis. The next common sign which we can see in appendicitis is that it is the Dumpy sign. So pain is being present whenever the patient is coughing, and the pain you can see it is mostly on the MS.Brammu.D point, that is the right iliac, very close to the right anterior iliac fossa. The other important sign here over here is that in appendicitis you can call it as the Aaron sign. It's nothing but like when you do the palpation on the MS.Brammu.D point. Okay. So when you palpate or do a deep palpation on the MS.Brammu.D point, patient is going to have a referred pain or discomfort in the epigastric region. The exact pain is not over here. It is being radiating. Patient is having severe pain in the epigastric region or might be pain in the precordial region due to continuous firm pressure on the MS.Brammu.D point, which we call it as the Aaron sign. The other important sign which we can evidently see in a patient with appendicitis is that Schwerin's triangle. So in this you have a boundary. So here in this boundary, like it is like a sort of a triangle starting from the umbilicus. You draw an imaginary line till the symphysis pubis. Then again from there you draw an imaginary line to the anterior superior iliac spine. And from the anterior superior iliac spine, another imaginary line is drawn to the umbilicus, which is having a sort of a triangle. So whenever you feel that the patient is having hyperesthesia in this triangle, in this shaded triangle, it shows that patient is having acute appendicitis. And the other important sign which we call it as the Lance point. So here we call it as the tenderness which is present in the part of the 1/3 of the distance from the right anterior superior iliac spine to the left anterior superior iliac spine. So this diagram will be easily you can communicate and you can understand. That is that here there is an marking which you have the anterior superior iliac spine right as well as on the left. Just very close to the MS.Brammu.D point to the lower end you can have the Lance point, where patient is having severe pain in the Lance point in case of appendicitis. So I am very sure that you are now thorough with all sorts of signs of appendicitis, starting from rebound tenderness till the Lance sign. And if you have any doubts, please put in your suggestions and as well as your doubts under the comments box. And don't forget to subscribe as well as please forward my channel to all your dears and ears so that they will be able to have their inputs and as well as they can have more knowledge towards nursing. Hope you all enjoy nursing through this session. Thank you all. See you in the next topic.